Dear gentle viewers, we all know pregnancy is always described as a beautiful journey, but for many women, it has also become one of the most physically and emotionally challenging periods of their lives. Across Nigeria, we continue to hear heartbreaking stories of women developing severe complications during pregnancy and childbirth, from preeclampsia to excessive bleeding to sudden loss of sight, organ complications, skin changes, and even death. Sadly, many warning signs are ignored, sometimes because of work pressure, lack of awareness, financial challenges, or even the belief that it's just a normal pregnancy symptoms. Today on the Amina Ataru Show, we are having a very important conversation on pregnancy, maternal health, and the complications women and families need to pay attention to before it becomes too late. Joining me is an obstetrician and a gynecologist known for her years of service, over 15 years of active service in the medical field. Her insight and real life experiences, practical information that everyone needs to know is something that she'll be sharing here today. Ladies and gentlemen, this is the Amina Ataru Show, and you're welcome to another impactful conversation. Please stay tuned.
The Amina Ataru Show, finding answers.
Thank you for staying tuned. This is still the Amina Ataru Show, and today we are diving straight into health matters, looking at one thing that everybody sees joyous: pregnancy and its mental health, some of the dangers and complications that comes with it. And I have with me someone, a doctor with over 16 years of active medical service in our beautiful country, Nigeria. She is an obstetrician and a gynecologist. Ladies and gentlemen, my dear gentle viewers, please join me as I welcome someone that was going to help us today with a lot of information that you're not paying for. My dear doctor, welcome to the show.
Hi, Amina. Good evening.
Good evening.
Thank you for having me.
I'm so happy to have you here.
Same here.
Yes. You have been in active service for 16 years as a medical practitioner.
Mm.
Do you want to share more light about your experience in that field?
Oh, well, it's been interesting. And then, like every profession, filled with its ups and downs. The good days, you're birthing babies, bringing life to the world, lots of joy and cheer. And the sad days where, unfortunately, you have to break the sad news of the loss of a dear one to relatives. It's a mix of emotions, but in all, it's been fulfilling and rewarding knowing that I have been able to contribute my quota to ensuring that Nigerians maintain a level of health.
Great. Some people always, there's always this misinterpretation between being an obstetrician and a gynecologist. Would you mind helping us elaborate on that for us, please?
All right. Obstetrician gynecologists basically deal with one sex, that's the female.
Okay.
All right. So females, when you're managing females in pregnancy, issues related to pregnancy and all that, then that's obstetrics.
Okay.
Then any other thing concerning the female health and well-being outside the period of pregnancy is gynecology.
Oh, that's gynecology. So after I give birth, it's a gyne.
You were first a female before you got pregnant.
No, I mean for the doctor that attends to me. Who attends to the woman when she's in the labor room?
The obstetrician.
The obstetrician attends.
Yeah.
And then after you have...
Yeah, till, you still come to the 6 weeks postpartum clinic.
Yes.
Yeah, so till that period, you're still you're still under the obstetrician. Yeah.
Oh, nice.
So anything outside that period is gynecology.
Have you ever experienced most of these complications that have been shared? Not just online, but I'm sure you've had patients who, complained about one complication or the other after pregnancy or even before, they bettered their baby. Do you mind sharing some of this experience?
All right. Pregnancy is a beautiful journey. All right. It's also one that comes with a lot of changes across all the systems and organs of the body. right from the brain, the eyes, the skin, everything. All right. And that's what also makes pregnancy a vulnerable period, and the period where women need specialized care and attention. And then let's not forget the mental health part of it, right? Because it's really an emotionally tasking period for women. All right. And then these complications can span across all the organ systems, and then also all the organ systems. So taking it trimester by trimester, the first trimester, that's the first 13 weeks of pregnancy, you would usually be dealing with things like the nausea, the vomiting, which for some people can be quite extreme. Quite extreme. Some cannot even hold anything down. They would need to be admitted, supported with intravenous fluids, some medications, and still come with the issue of the miscarriages, which are common in the first trimester as well. And then even things like ectopic pregnancy, when pregnancy is not located in the right place, all right? And this is a silent killer for most women, because, oh, you're ecstatic over the joy of, oh, I've had a positive pregnancy test. But in that, it's also important to please get an ultrasound scan to localize and be sure that that pregnancy is growing in the right place where it should be. Because if not, it can lead to very possibly disastrous consequences. So when we're past that, we enter the second trimester, second half of pregnancy. We now start seeing things like the anemia, the low blood levels, the hypertensive disorders coming, the sugar problems, gestational diabetes, all right? And then also can come at that time bleeding in pregnancy, which might be related to issues with the placenta, things like a low-lying placenta, which we call placenta previa, to a premature suppression of the placenta. That's the abruptio, all right? And then even down to even preterm labor, pre-labor rupture of membranes. That's when a woman has broken her water and is not in labor. And the list is endless.
Wow.
Yes, the list is endless. And that is why we can never overemphasize the role of antenatal care.
But we have a lot of women, many, I even still know some that are like close to me. They tell you, oh, because I've given birth to 1, 2, 3, there's no need for, I don't do antenatal because I already have, I'm experienced in that field. They don't go for antenatal. They start to go for antenatal from when they're like probably in their second trimester for 6 months. I'm always scared because I always see things like that as risky. Can people like that actually ignore simply because I have given birth to 3 children I have experience? Can I actually pass, just skip antenatal and say I know all the drugs that they'll give to me and everything?
Oh, wow. That's the mistake that most people would make. Just like if you look at siblings from the same parents, they have their similarities, but they also have their differences.
That's true.
So also every pregnancy is unique and different. There is no experience in the field because these complications can crop up at any time with any pregnancy. I've also come across some patients who have maybe had vaginal deliveries first, second, and then in the third, something crops up and then they have to have a cesarean section. So please, that is one myth that we strongly need to dispel. You can never be overexperienced when it comes to pregnancy. And even those women who have had multiple pregnancies are even at higher risk of developing some complications.
Now, I like to pick on one that are either personal to me and quite of other issues, complications that women have actually raised. I want us to, pick more on the ectopic pregnancy, right? The one where the child or the fetus is growing outside the womb. What happens when that occurs? Is the mother advised to still carry on with that pregnancy or terminate?
So ectopic pregnancy, like you rightly said, is when the fetus is growing in other areas except the uterine cavity. Now, the uterus or the womb is a muscular organ. It's made to expand, enlarge to accommodate the baby as the baby grows. But when the baby is in other locations, something like the fallopian tube or even other areas in the abdomen, those areas are not made to expand. So what happens is that it grows to a certain extent and it gives way, it ruptures, and the woman starts to bleed inside, which can be a very life-threatening condition. All right. So it's important that once you confirm pregnancy, you have a scan to localize that pregnancy, be sure that it's in the right place. Because sometimes they're just coming with, oh, pain here. And well, unfortunately, Nigerians are very good with over-the-counter medicines. Yeah. So you're going to the pharmacy, they're giving you one pain meds after another. Meanwhile, the woman is bleeding inside. And then you suddenly hear, oh, she was walking, she just fell down, village people.
Yeah, because I don't know, have you ever experienced, have you had things like, okay, a woman missed her period for maybe 3 months and then she believes she's pregnant. She has the symptoms of, pregnancy. However, she's gone for all the scans and they don't see any. And then 6 months after, there's practically a child. I don't know if you've ever experienced something like that. Is that part of the anatomy? Is that part of the fetus growing outside?
No.
Okay.
So if you have had a scan done and you're actually pregnant, irrespective of where the pregnancy is located, the scan would pick it up. So, we also live in an era or times where there is this trend, if I would call it that, the cryptic pregnancy kind of thing.
Yeah.
So, that is a scam.
Oh.
Yeah. So these women, that our sociocultural belief places a high premium on children and the ability to bear children. So women or families, families who are having some challenges with being able to conceive are actually going through a lot. And they can go to any length to get what they want. So these unscrupulous individuals just prey on their naivety and their what is it called now?
Their urge for being
their hunger. And then what they do with these women, they come and tell them, oh no, you're pregnant. They keep injecting them with hormones. So these hormones are hormones similar to what the body produces in pregnancy. So you would see them having all the pregnancy symptoms, the bloating, everything. They would have that. And then they tell you, oh, don't go to the hospital. A scan will not see the baby.
Yeah.
They will see the baby. You are coming for antenatal everything. Meanwhile, they are arranging. And the funny thing is, they will tell you, they will be the ones to tell you the day you will come for delivery. They'll be the ones to tell you when your labor will start. That's false. And then they've arranged for maybe one baby factory or something, and then you come, they just give you a cord, put a plaster, or just then tell you, oh, madam, this is your baby.
Wow.
Yeah.
It happens in our country.
Well, yeah, it does.
Interesting.
So any pregnancy that a scan cannot see is not a pregnancy.
It's not a pregnancy. Any pregnancy that a scan cannot see is not a pregnancy. Before we go on this break, we're going to be discussing as well on preeclampsia and what leads to it. We all saw the video that trended a while back where a woman after giving birth went totally blind. What leads to things like that? We're going to be discussing it today on pregnancy and its mental health. Please stay tuned.
The Amina Atairu Show, Finding Answers.
Thank you for staying tuned. We're still discussing pregnancy, complication, and mental health. And I still have with me Dr. Larson Onyinye, an obstetrician and gynecologist, discussing and throwing more light on pregnancies and signs that you and I, intending mothers and mothers in waiting, should not ignore. We're talking about the video that trended recently about the woman who went blind after pregnancy. What would you say she ignored?
Mm.
What leads to things like preeclampsia or blindness in pregnancy?
Okay, blindness in pregnancy can be due to some possible factors.
Okay.
One is the preeclampsia, right? That's where you have the elevated blood pressure, you have protein in the urine, and then also some organ dysfunction. So eclampsia can affect not only the eyes, where it can lead to blindness, which usually is reversible if addressed early. Preeclampsia also affects the brain, so that can cause women, pregnant women, women in labor, even women who have delivered, to have seizures, convulsions.
Really?
Yes, that's where it goes to eclampsia. It can affect the kidneys. It can cause the kidneys to fail. It can affect the liver.
Is that bad?
It's that bad. So it's important that, you see, when you go for your antenatal, they check your blood pressure. They give you a container to pee. They check your urine. Those are not rituals. They're not just doing it because that's what they need to do. They are actually looking out for signs of such things. So far above even the hypertensive disorders in pregnancy, other things that can cause loss of sight or temporary blindness or even permanent, diabetes, especially maybe for people who were diabetic pre-pregnancy and have developed some complications of diabetes, like the diabetes that affects the eye, diabetic retinopathy. All right, so they can have a progression, a worsening of this condition in pregnancy.
How do I know that I am diabetic? When probably let me use myself as like the example now. I was pregnant 8 years ago. I had with my baby. I don't think I missed any antenatal, right? I took a trip, went for a business trip, returned. I took a trip, went, outside Lagos and returned. And then I noticed that my leg was, swollen. I felt it was normal because there are times that, when probably you were worried because you're pregnant. I mean, my leg was swollen and whatnot. And so I was forced to go because I went to the hospital a week before, right? To, do my checks. And I went back there. I was in my second trimester then. Yes. And I went back and that's how they seized me in the hospital. Because my BP was over 235 or so. Or yes. It was, Dr. Falarin that's, that actually did. And they locked me in the hospital for 2 weeks.
Mm-hmm.
You understand? Now, in my own case, I wasn't diabetic. I don't think I was diabetic. I don't know how the BP went off the roof. I was only walking my normal routine. So for someone like me who had that, my BP went off the roof. 2 weeks, I was shut down. And then, of course, 2 weeks into my delivery, into my EDD, I actually, had partial blindness as well. I had preeclampsia myself. And I was worried. The only thing I could see was my credit alert. and every time I had to zoom and like my eyes were swollen. Were worried and all that. I couldn't even see my baby. I didn't know the color of my baby when they brought her out because I had to do CS cesarean. Until like 2 weeks, I think 5 days after I started, clearing up. So for someone like me and many other people like me that have never had anything like blood pressure in their family, no history of diabetes, what went wrong in my case?
Nothing went wrong per se. We did say that with pregnancy comes a lot of changes, hormonal changes, all right, across every organ and system. Those hormonal changes can predispose the pregnant woman to developing what we call gestational hypertension or pregnancy-induced hypertension.
Okay.
All right. Now, when you talk about hypertensive disorders in pregnancy, it's a spectrum, starting with the pregnancy-induced hypertension, down to preeclampsia, and then eclampsia. Eclampsia is when the woman has actually had a seizure, a convulsion. So it's a spectrum. It's not, yes, we know that there are certain risk factors that can increase one's risk of developing it, a previous history of hypertension, a family history of hypertension, women who are carrying multiple pregnancies, women who have had maybe diabetes in the past, all those things, advanced age, elderly women. Okay, but far above that, there are women who have no risk factors whatsoever, are fine, and still develop it. So it's pregnancy related.
Okay.
It's because of the hormonal changes of pregnancy. And then that is where the regular checks come in to pick it up. Of course, yes, certain symptoms like if you notice a rapid increase in weight, so a rapid weight gain, or yes, we know that leg swelling is normal in pregnancy because of the retention, the fluid retention that happens. But when you notice one that just rapidly comes up, then it also raises a red flag. If you start to have headaches that when you rest doesn't seem to go away. If you start to have like the heartburn, all right. If you notice a reduction in your urine output, or you notice a bleeding for any reason, so those are
the
things.
spotting, like
It's better to be safe than sorry.
okay.
So yes, all those things are things that raise your alarm or ring the alarm to say, okay, go get checked. Could it be this? All right, so that when it's caught early, it can be addressed. Even above, outside hypertension in pregnancy, the fluid retention in pregnancy also causes some changes in the eye. So pregnant women, you're retaining fluid. You notice that, oh, your prescription glasses are no longer seeing properly. Your contact lenses are no longer fitting in properly. That's because of the fluid retention, the changes in the curvature of the eye and all that. Okay, so that's where the examination comes in to know what is normal and what is not.
Amazing. Still a lot of questions. So in the area of, you also talked about low blood pressure, right? In pregnancy. What leads to low blood pressure in pregnancy? And there's this narrative about it's better for you to have a high blood pressure than to have a low blood pressure. Why is that statement out there?
Okay, so low blood pressure in pregnancy can be normal because part of the changes that occurs in the vessels in pregnancy is that they dilate, they open up. All right, so that can cause the blood pressure to go down. All right, so in pregnancy, when we see low blood pressure, we're not really alarmed, depending on the trimester at which is happening, of course. And then we also tie that to whatever signs or complaints that the woman might have. So if you notice that, oh, your blood pressure went low in pregnancy, that's not a cause for alarm. It can just be a normal physiological change that happens in pregnancy.
Okay, so I want to look at some of the complications and warning signs. Some women reported excessive bleeding during childbirth, and that has actually remained a major cause in the Nigerian health sector. What would you say leads to excessive bleeding in childbirth?
Right. The major factors would either be the uterus, the womb, because after delivery, the womb contracts. It shrinks back, all right? And that contraction also helps with the bleeding, to clamp down on the bleeding vessels to stop the bleeding. So if for any reason the uterus doesn't contract after delivery, then the woman can bleed. If there are tears, vaginal tears, cervical tears, or tears around the genital tract, that can cause bleeding. Then when there are remnants of either placenta, tissue, or membrane, all right, that wasn't properly all evacuated, the woman can bleed. Or if pregnancy is a state that predisposes a woman to forming blood clots. All right. So also complications related to blood clotting can cause a woman to bleed. But in all this, the major contributory factor is the uterus not contracting after delivery properly. All right. So that's where it's important that every birth is attended to by a skilled birth attendant, because there are medications that we give post-delivery to help achieve that
contraction. Okay, now still looking at that, what about the angle of infection? I know quite a number of pregnant women that experience a lot of infections during pregnancy, either itching or some funny discharge and whatnot. And for some, regardless of the medications that they give, it just still stays. And then doctor says it's normal. Is there anything normal about infection in pregnancy?
All right. So, pregnancy is a state that reduces the immunity of the pregnant woman.
Okay.
So, infections that your body could easily fight off, you are susceptible to it. And then the most common cause of that recurrent discharge and itching in pregnancy is candida.
Yeah.
All right, candidiasis. So you hear them say, oh, I treated it, it came back. Yes, that's one, the reduced immunity. And you know also the increased discharge with pregnancy. That area is not like the skin that is exposed to air and all that. So, and candida is a fungal infection. It's just like if you live in a house where the walls soak water. After a while, you'll see the mold coming up.
True.
All right. So because of the increased discharge, that place is wet and all that. So that also helps to, as in, can contribute to the frequent candidiasis that comes up. And it's important to also get sugars checked because diabetes, either pregnancy-induced or pre-pregnancy, is also one of the causes for that recurrent candidiasis. So if your doctor has checked all that and said, oh, it's just part of pregnancy, then paying attention to hygiene, ensuring that you use underwear that are not so tight, retaining the menstrual, frequent changing to keep that place as dry as possible also helps with reducing the frequency.
There's no recommended medication that you need to take. Why that? No,
you'll be treated.
Okay.
But will it possibly recall? Yes, because you're still pregnant and your immunity is still low. So paying attention to all those other things helps with reducing the frequency with which it recurs. Yeah.
Amazing. Lastly, before you go, there is a major concern when it comes to most of the research that we have done, both in Lagos and outside. We always find out that women always delay antenatals. In your years of experience, what would you say has led to things like that? Would we say from our own angle, is it the fact that it's expensive or is it free? Which?
All right. Delaying antenatal, you mean late registration?
Yes, late registration.
Yeah, that's one factor. All right. And then usually more common in women who feel they have experience. So you would usually see most first-time mothers coming early. Oh, they're excited, they're pregnant, all right? And they present early. But by the time they've had 2, 3, there's this video that tried at one time as a going out with your baby as a first-time mother, where you have all the versus when you have 2 or 3, just straight that. So that's the same thing that most times would happen. All right. And then about cost. Healthcare is available across all cadres, from the primary healthcare centers to the government hospitals, general hospitals, before you graduate to the teaching hospitals, and then, of course, the private hospitals. So wherever you look, you would find healthcare that is affordable and available to you. In some government facilities, it's also almost free. Oh, yeah. So aside the cost of probably transporting yourself to the hospital, you're getting healthcare almost free.
Amazing. Lastly, can pregnancy complication affect the baby?
Definitely. The baby and the mother are one unit. Anything that can affect the mother can affect the baby.
So what are the signs that mothers, young mothers, intending mothers, should look out for? And then let's look at the angle too of the family, the husband, the mother-in-law, whoever. What would you say, as a doctor, your years of experience, how have you counseled a few of these people that had reservations or emotional issues coming from their houses?
Pregnancy is a unique state that leaves the woman vulnerable. And it's a period where she needs all the support she can get both from home, from work, and from the society. We should learn to start making concessions for pregnant women because believe you me, they're going through a lot. And the family units plays a very important role. Everyone, please, we need to rally around pregnant women. Please, this is an appeal. Remind them to take their medications. Encourage them to use their medications. Encourage them to go for antenatal classes. Even follow them, accompany them. Where I once used to work, when we see fathers that come with their wives, we give them preference. Yeah, we give them preference for coming. It's a bonus. So please, each step of the way, your wife is not acting that way because she wants to. She's acting that way because of the body changes that she's experiencing. That is sometimes overwhelming. And even beyond pregnancy, you know, a lot of attention focuses on pregnancy. Post-delivery, you know, nobody really prepares you for that. Nobody really prepares you for that. And it's also a period where women need all the support that they can get. Because they are at that point even more vulnerable to developing those mental issues. Yeah. From postpartum blues to even frank postpartum depression or psychosis. All right. So please, when you're around a pregnant woman who just suddenly starts crying, loses interest in taking care of her baby, doesn't want to talk to anybody, doesn't want to just see the baby, please don't snap. She is not seeking attention. She is not trying to pull you out from your sleep or whatever. She is actually going through a lot and needs all the support that she can get.
Hear that? Pregnant women need all the support they can get, and pregnancy is not, how would I put it? The experience is not, it's not universal. It's different.
Exactly.
Each woman, each body with their own life experience. Thank you so much, Dr. Lasin Onyinye. We're still going to bring you back here to discuss on postpartum depression. Right, because that is strong to also discuss. So we're going to drag you all the way to bring you on the show. But we truly appreciate your insights, your experience. Thank you for coming on the show. Yes, on behalf of everyone, my gentle viewers, thank you very much for always keeping tuned, for always keeping locked on the Amina Atahiru Show. Don't forget to subscribe on the channel. Click the button below. Follow us across all our digital platforms to learn more. Share us your real stories, issues that you want to hear about, discuss on the show. And of course, we will ensure that our conversation always brings strong impact. On behalf of myself and my amazing, amazing crew, thank you very much. Bye-bye.
Atahiru Show, Finding Answers.